Hi there. Welcome to The Defender, Wisconsin's environmental podcast. I'm Amy Barrilleaux. The Defender is powered by Clean Wisconsin, your environmental voice since 1970. I want to start by acknowledging that I know it can be unsettling, frustrating, even scary to listen to stories like the one you're about to hear. Stories that show how our own government, the federal agencies that are supposed to protect us, is in some cases actively working to undermine our protections. We cover these issues on The Defender because they are, of course, important and because knowledge is power. If you're feeling frustrated, stick around until the end of the show to learn about how to get involved in the fight to keep our environment safe. In this episode, how new action from the EPA is undermining one of the most successful environmental laws in U.S. history. That's right now on The Defender. 1970 was a pretty big year. We had the first Earth Day, Clean Wisconsin was founded, and our nation passed a landmark law meant to protect people from deadly toxins in the air, the Clean Air Act. It proved to be one of the most successful pieces of environmental legislation ever, improving air quality across Wisconsin and the country. But the EPA has just taken a major step to undermine that achievement. The agency will no longer calculate deaths avoided and healthcare savings when considering the impact of air pollution rules. Joining me to talk about what that really means for the air we breathe is Nick Mailloux, researcher at UW's Nelson Institute for Environmental Studies. Nick, thank you so much for being here.
Thank you so much for having me.
Before we get into what the EPA has done and what they're going to do, how did you get interested in this? Because I think we don't always think about, pollution and health and all of these issues that you work on as a thing, in our day-to-day lives. So what got you to where you are and what you research?
Yeah, well, before I pursued a PhD here at UW-Madison, I was working in Washington, D.C. at the Union of Concerned Scientists, a science advocacy nonprofit. And there I was focused primarily on issues related to clean energy adoption and climate mitigation. So I came at the air quality and health topics from that angle because at the time, UCS was starting to, UCS and folks broadly were starting to appreciate this connection between mitigation of climate change by reducing greenhouse gas emissions and the co-benefits that those actions could provide for our health through improvements in air quality. Because many of the same sources of greenhouse gas emissions that are the primary cause of global warming and associated climate changes are also primary sources of criteria air pollutants that have effects for our health in the near term.
When you talk about, criteria air pollutants and effects for your health, you're really talking about, I guess, some really key toxins that can really hurt us. So what are we talking about when we talk about these important types of air pollution that you're looking at?
Yeah, well, there's a whole host of different types of pollutants that are regulated under the Clean Air Act by the U.S. Environmental Protection Agency. A big category is something called criteria air pollutants, as I said, which is 6 pollutants which are regulated under something called the National Ambient Air Quality Standards. And these pollutants are regulated under these standards primarily because of their known harms to human health. And the two main ones that we tend to think about are something called particulate matter, which we can think of as soot air pollution, and ground level ozone, which is the main component of smog. And both of these pollutants, for decades now, we have understood the connection between exposure to these pollutants and harms in human health.
What are the kinds of harms that we're talking about? Because I think you hear smog, and I don't know if everybody kind of appreciates what that is. And soot doesn't sound like so bad. So when we talk about these, particulate matter, air pollution, or ozone, ground level ozone, what are the kinds of things that breathing this in does to us?
Yeah, it is something of this invisible threat because it's only on some of the days with the worst air pollution that we can even really visibly see it. We can see that on days where there's a lot of wildfire smoke obscuring the sun, where you can look at the sun in the middle of the day, which we should not be able to do. So it's only on those days that this issue might be as salient. But just the long-term exposure to even low levels of these pollutants over the course of a year, many years, a lifetime, take a toll on the body. So we have established evidence for over 30 years now of the effects of some of these air pollutants on human health. And the types of health harms range widely. It's exposure to air pollution is implicated in health harm from heart disease, lung cancer, stroke, asthma, chronic obstructive pulmonary disease. The more we learn, the more types of health harms are implicated, because especially fine particulate matter or soot air pollution, which is the leading cause of air pollution-related health harms around the world. These are particles that are fine enough where when we inhale, they can pass through our airways into our lungs, where they can pass into our bloodstream, leading to inflammation that leads to lots of different cardiovascular and respiratory health harms.
So the EPA, notably, has a mission of protecting public health, or at least it used to up until relatively recently. Now I've heard, unleashing the power of AI is among the things that the new administrator of the EPA talks about. But back when it was focused on public health, regulations, limits to air pollution were part of what the EPA sought to do. Controls on power plants, manufacturers, factories, things like that, to try to cut down on the air pollution. And they had to look at these health harms and, I guess, weigh the societal cost of these health harms. So what is the EPA, or what has it for decades done with that kind of knowledge of the health harms of these particular air pollutions to kind of get a handle, I guess, on the societal impacts?
Yeah. It is still the stated mission of the EPA to protect human health and the environment. And traditionally what happens in the context of air pollution regulation or pollution control limits is that we have an understanding of what the major sources of emissions of pollution look like around the country. And EPA regulates emissions from many different types of facilities that put pollution up into the atmosphere. So this is things like power plants that generate electricity, that power our homes, the vehicles we drive, many different industrial sources. And in the course of understanding what the emissions from those sources look like and how they might want to regulate it, EPA will provide these assessments and regulatory impact analyses. That part of that is an understanding of the potential cost and benefits of some proposed regulation or some proposed limit on the amount of pollution that can be put up in the atmosphere from a certain source or a certain category of sources. And in that cost-benefit analysis, EPA looks at many different things. They're trying to understand what the compliance costs for industry might be, because it's the case for a power plant, for example, that uses coal to generate electricity, that there's a lot of sulfur dioxide emissions that come off of that. And we also know that there are technologies available that power plants can install that scrub some of that pollution out of before it's coming out of the smokestack to reduce the amount of pollution actually entering the atmosphere. That obviously carries a cost for the operator of that power plant. So they want to understand what that cost is on the pollution side. But if we just look at the cost, then we're not getting this full understanding of the potential or the relative costs and benefits of that to society at large. So in proposed regulation, EPA will also include estimates of the potential health implications of improvements in air quality resulting from decreased emissions from these different polluting resources.
So I'm going to offer up a bad analogy here. So it's kind of like if I have my car and I'm looking at the cost of an oil change and I'm like, man, I don't want to pay that $50. And I don't at all look at the cost of what happens if my car runs out of oil. I only look at the upfront cost, like one piece, I guess, of the whole big picture.
Yeah, well, in that analogy, the upfront cost to you of getting the oil change is still a cost to you, and the potential larger cost you would pay down the line if you didn't change the oil in your car is still a cost to you. But what I think is important to recognize about these cost-benefit analyses the EPA undertakes is that the groups of people who are paying the cost are not necessarily those who are benefiting. So the costs of compliance with a lot of these regulations are more acutely felt by polluting industry, whereas the benefits in terms of improved air quality and reduced health harms are felt by all of us.
So basically, the pollution and the cost of it is being paid for by anybody who's exposed, by the communities where the pollution is. And I think we understand that, that because we see that sort of thing all the time. There's a spill from 50 years ago. Now taxpayers have to pay to clean it up because that company's long gone. That polluters put things into the environment and then everybody else kind of has to deal with the consequences. So this was an effort by the EPA to kind of be like, okay, we need to understand what the harms are and the benefits are and have like a kind of a calculation. So if we look at society-wide, this pollution is causing, this number potentially of hospital visits and this number of premature deaths. I mean, they really were looking at basically assigning a cost to the premature deaths caused by these air pollutants. Is that right?
That's correct. Yeah. So included in the estimation of potential benefits of air quality improvements resulting from Clean Air Act pollution controls are things like the monetized benefits of avoided mortality resulting from those improvements in air quality, as well as the maybe more tangible impacts in terms of avoided costs from reduced numbers of hospital admissions or emergency department visits, which we also know are linked to air pollution exposure.
And there's a lot of research around this, really, that where it's kind of like, yeah, we're really looking at if you cut down on this particular pollutant by this amount, then you're going to save this many lives and this many hospital visits. And that's kind of what some of the research that you do looks at. Is that right?
Yes. So my research generally is trying to quantify the potential air quality and health effects of changes in the energy system in the U.S. So as we take these actions to increase adoption of renewable energy technologies, replacing fossil fuel generation, which are some of these primary polluting sources, and generally mitigating climate change, what might the potential air quality and health co-benefits be? So included in that type of analysis is an understanding of the change in emissions from different polluting sources, which then translates into a change in the concentration of pollution that we're all exposed to going about our days. And from there, we can provide estimates of the potential health implications. And then as a final step in that modeling chain, we're able to understand what the potential economic damages or benefits of different policy scenarios might be.
So for decades, the EPA has been kind of paying attention to this, right? They've been factoring that in when they look at the cost of a new regulation. They look at the cost to comply and then the benefits, the savings. Now that seems to have changed. So what has the EPA done to start moving away from this?
Yes, so it was at the time of this recording earlier this week that we had a final rule from EPA come out, which was focused on performance standards for different stationary combustion engine sources. So this is things like the turbines that run at natural gas power plants. And in that final rulemaking, EPA stated that they would no longer be characterizing the monetized health effects of changes in air quality resulting from these rules. So that is a sea change from decades of longstanding practice at EPA to calculate the health impacts of major rulemaking related to the Clean Air Act.
So it is going to be basically, we look at how much it costs for a polluter to comply when we're trying to make our decision, and then nothing about what the societal cost is of not complying.
Yeah, exactly. And they provide a few different reasons for this. One of which is that they say that a lot of recent rulemaking from EPA has relied on these more simplified methods of understanding what the potential air quality and health implications of rules might be, which is rich from an administration that just last year said they would dismantle the Office of Research and Development at EPA. So they're lamenting a loss of this scientific expertise that is brought on by their own actions to reduce the number of people who are actually able to do the good work that the folks at EPA always do.
When you heard about this, that the EPA was not going to be, looking at the cost of hospitalizations or premature deaths or any of these things anymore as it seeks to potentially fulfill its mission of protecting public health, what was your reaction?
I can't say that I was surprised, given what we've seen coming down the pike in terms of past actions from this EPA and the shift in focus away from the stated mission of EPA to protect human health and the environment to these other and broader initiatives of the administration. But it's unfortunate because this means that if this type of omission in EPA rulemaking is to continue going forward, then our government is depriving us of critical information about the potential implications of actions that it's taking on our behalf.
Okay, you're going to have to translate that a little bit. So it's, we're not going to be able to understand, fully understand what the EPA's actions are going to mean for communities. Is that basically what you're saying?
Yes. So there's really no replacement for the work that the scientific staff at EPA do to provide these estimates to us in their proposed rulemaking. So then we, as members of society, are able to understand the potential implications of rules that the government is proposing and weigh in on them during public comment periods for draft regulations and things like that, where now that information will not be provided by EPA, and it's possible for outside groups, academic groups, to fill in that gap. But really, that is the role of these regulatory agencies to do that work themselves.
I think sometimes it's easy for people to forget what life was like before the Clean Air Act, before the EPA even. I know you weren't around probably back then, but what should we think about, in terms of what rights or what protections people had 50, 60, 70 years ago?
Yeah, I wasn't there, but I hear it was terrible. I'm sure there were many good aspects of life before the EPA, but I like the life that I live in a moment when the EPA does exist. Before the EPA was founded, there were a number of instances of really terrible air pollution events across the United States. So events in the 50s in Donora, Pennsylvania, where pollution coming off of a mill near a river caused people to have to put on their headlights in the middle of the day because the pollution was so concentrated that you couldn't see. The sunlight couldn't reach the ground. And the Cuyahoga River in Ohio catching on fire dozens of times, I believe, in the decades before EPA was founded. And really the pollution controls that have come out of the Clean Air Act and the founding of EPA, both in the same year, have been tremendous. So we all enjoy healthier and longer lives today than those living decades ago did in the U.S. because of government action to clean up pollution.
How important is, you talk about the science and research arm of the EPA. How important is that for transparency, to really be able to see into how decisions are being made and the data behind the decisions that are being made? Are we starting to lose our ability to even hold the agencies that are supposed to serve us into any kind of accountability?
Yeah, well, it's challenging. I mean, I'll say that the civil servants who dedicate, some of them, their entire careers to working at agencies like EPA are doing the good work that needs to be done. And I, as a researcher at a university, am reliant on data and resources and compiled information from EPA every day that I go to work. EPA is the gold standard of air regulators anywhere in the world, and the information they provide is key for everyone else in this space to be able to understand the problem, the actual scale of the problem of air pollution in the places we live, whether that's through air quality monitoring networks that are operated by EPA, or whether that be modeling tools that those of us outside of government use because EPA has developed them and made them publicly available to us as taxpayers. And yeah, it's difficult when leadership in these agencies don't make it a priority to support the good folks at these agencies who are doing the work that needs to be done.
At Clean Wisconsin, we have an environmental health initiative where we are really looking at pollution that's out there, like these air pollutants we've been talking about, like water pollution, and connecting them to public health harms and to eventually, at the town and city and neighborhood level of different health impacts. Do you think people realize that the pollution that they're exposed to can have a direct impact on their lives and their health and the health of their children?
Well, I think the last few years, at least here in Wisconsin and other places in the U.S., have made the issue of air pollution more apparent, in that we've seen the really terrible consequences of these climate-fueled wildfires in western parts of the United States and in Canada, where if anyone listening was here in Wisconsin in the summer, June, July of the last couple of years, there were days where we were pulling out our KN95 masks from the early days of the pandemic just to make sure that we weren't exposed to the particulates in the air from this wildfire smoke. So I think it's increasing in salience. I hope that it's increasing in salience for folks here and elsewhere. But I also think that folks have a lot of other things that they're spending their time thinking and caring about, and people live busy lives, and it's easy to forget. And in part, it's easy to forget about this because we have seen such achievements in improving air quality in the United States over the last number of decades, where we don't have to care about it in the way that we once did. And that's because of the actions taken by EPA under the Clean Air Act to improve the quality of life for all of us.
Yeah, I think that's a good point. We have, by and large, great air quality in many parts of Wisconsin, not all. Some are in non-attainment for ozone pollution, for example. But I think by and large, we are seeing those improvements. And so we don't think about sliding backwards. But as you see the direction that the EPA is going, are we going to get back to that point where things are really bad, where, whole regions of people are calling for solutions because they have to turn on their headlights in the middle of the day, or their river is on fire, or any of these things?
I don't think it'll get that bad. But what this moment in time means is that we're not continuing to make progress where we know where there's still progress to be made. So the actions we could take to mitigate climate change by transitioning a largely fossil fuel based economy to one that's powered by clean energy would also have huge benefits for air quality and health. And we're not currently moving as quickly as I think we should be on that front. And that's going to have consequences in the meantime. I also want to acknowledge, to your point, that air quality is good in a lot of places in Wisconsin and less so in others, that it's also true that the legacy of racist housing policy in the United States and other segregation efforts show up in our understanding of the patterns of exposure of air pollution today. So many of the same neighborhoods that were disadvantaged decades ago as the result of formal government policy are still those that are exposed to higher levels of air pollution today and are nearby to large highways and to industrial facilities. So efforts to reduce disparities in air pollution exposure are also seemingly at a standstill in this moment.
And that's a good point. Clean Wisconsin's own analysis shows that Wisconsin has the third highest racial disparity in terms of exposure to particulate matter air pollution, which is the most harmful kind of air pollution. And sometimes I think that makes it easier for people in other parts of Wisconsin to be dismissive, to think of things as not their problem. How hard is it when you talk to people for people to really understand that that you can't just dismiss, just because it's something that's not near you or you can't see it. You can't dismiss the societal costs of pollution.
Yeah. Well, the first thing I would say is that none of us is free of the effects of air pollution. The best scientific understanding at this point shows that there is no level of pollution exposure below which we can assume it's safe for our health. All the way down to zero, all the way down to very low levels of exposure, there is some harm that's being done to all of us just by breathing in air pollution that we're exposed to every day. And I think for folks who might not think it's something that affects them in a direct way, and it might not, they might live in a place that has better air quality than somebody else, but we all pay into these systems of Medicare and Medicaid that are providing the medical services that folks need when they're going to the emergency department because their child has an asthma attack or they're having trouble breathing, which might be caused by bad air pollution. So there are these costs in the system that we're all paying as a result of the exposure of ourselves and others to these pollutants.
There's so many levels of things that we could talk about here. One thing I did want to ask about is, as a researcher who relies on this data from the EPA, where does this leave you? And I'm going to guess just many, many researchers all across the country.
Luckily, a lot of the data sources that I rely on from EPA have seemed to remain intact to this point. But it's worrying that there is no longer a guarantee that that will be so. I was teaching a class on air quality last spring semester in 2025, the early days of this current administration. And there were days where we were relying on, my students were relying on information from EPA websites, and they went dark. And it was a question of whether they would return in an hour for unscheduled maintenance or something, or whether this resource was no longer to be made available. So in terms of the data that I rely on, a lot of it is still there. There have been efforts by EPA to say that they're going to stop collecting data and things like that related to greenhouse gases and other sources of normal data collection. But I have been a little bit spared so far, but there's no guarantee.
So I've been told that doing a podcast about the environment is a little depressing. Sometimes, a lot of times talking about the environment is hard. Like, this conversation is not, a feel-good story. But it's important. But I do want to ask, you do this work day in and day out. What gives you hope every day to come in here and do this and teach students and talk about these issues?
Yeah, the question of hope is a big one. And I think I'll quote a climate scientist, Kate Marvel. There are very few quotes that I commit to memory, but she has this great essay that she wrote a number of years back on the difference between hope and courage. And she says that it's not hope she relies on, it's courage instead. And the line that sticks with me is where she says, courage is a resolve to do well without the assurance of a happy ending.
So you've got courage in this moment.
Yes.
Nick, thank you so much for talking with me. I really appreciate it, and I appreciate all your insight on this.
Thank you so much for having me.
And thank you for listening to The Defender. I think if you are feeling overwhelmed right now, the best way to move forward is to take action, even if it's a small thing. As the saying goes, action is the antidote to despair. So a first step could be joining Clean Wisconsin's Action Network at cleanwisconsin.org/action. We routinely send action alerts with clear, easy steps to make your voice heard on all kinds of environmental issues. I'll also put a link in the show notes. And I'm also going to put a link to learn more about Clean Wisconsin's environmental health initiative, where we are connecting pollution exposure in our state to real-world health harms. Thank you so much for listening to our small but mighty weekly podcast, and apologies for this episode being slightly delayed. I'm Amy Barrilleaux. Talk to you later.